The opening of the 2012 World Health Summit, attended by participants from the areas of politics, research, and civil society. For 4 days, healthcare for the world was on the agenda.
Research for health and a sustainable future is the leitmotif of this year's World Health Summit.
The Congress took place for the 4th time in the heart of Berlin. The venue, the Langenberg-Virchow-Haus at the Charité University Clinic. 1,200 participants came to the event this year. Experts from around 80 countries were on hand. 2 of them, of course, were founding President Detlef Ganten and Michael J. Klaag, this year's summit president.
The most important issue of the World Health Summit, actually the first one and still ongoing, is the fact that medical progress is enormously fast, but the state of health in the world does not improve.
The more than 50 subsidiary events that make up the summit were focused on how to improve healthcare. Health problems are now similar all over the world, in both rich and poor nations.
If you look at the world as a whole, what people die from are non-communicable diseases. They die from cardiovascular disease, they die from cancer, they die from injuries. And within countries, you see that same mix.
But despite similarities, there are medical issues that are also specific to certain countries or regions. For example, some suffer from a lack of qualified doctors or nurses. And Lesotho's Deputy Minister of Health talked about another problem, the brain drain from poor countries to wealthy ones.
We started with unskilled laborers going to the huge economy of South Africa. Now it's the health workers who are moving. And this is very, very dramatic on the healthcare services.
The 2012 World Health Summit, a packed program with plenty of highlights. Social events offered other opportunities for exchange in issues like improving communication between lab and market, for example. What's the best way to speed up the translation of scientific results into therapies? Or looking at how the financial crisis is affecting healthcare in a less formal atmosphere, face to face. Yet another key topic was the role information technology plays in medicine. The huge amounts of data being generated have to be managed. IT is driving medical advances forward at a tremendous pace.
I'm also glad that IT now plays an important role here at the summit, which I think is for the first time that it plays such an important role. And I think that's extremely good sign because IT will revolutionize healthcare, that's for sure.
The World Health Summit also got plenty of media coverage. More than 100 journalists at the event generated reports for print, radio, and TV on the future of medicine.
There are 130 national academies around the world, as many as there are members.
The list of prominent guests was long. It included Kim Young-gan, Singapore's Minister of Health, Swiss banker and former head of Deutsche Bank, Joseph Ackermann, Joe Ivy Beaufort, the president of the New York Academy of Medicine, Nobel laureate Peter Eger, and many other important names from the worlds of politics, business, and research. The people responsible for making the world's healthcare systems work. Young scientists discussed the most pressing challenges with the movers and shakers in the worldwide healthcare sector. And the passion of the younger participants impressed the older hands. The next generation of healthcare experts certainly left their mark on the summit.
I really like the Congress because it brings together a lot of actors from the global health field, and so a very nice intersection of academia and private sector, and NGOs that actually talk on the topics.
And being able to discuss global health in a city like Berlin, I think adds some gravity to the event.
The highlights, I mean, everything has been mind-blowing.
The 2012 World Health Summit has been wrapped up. In 2013, John Wong from Singapore will preside over the event. It's already in the planning stage. See you next year in Berlin at the World Health Summit.